Yes, ma'am.
Okay, sir. Hello, everyone. A very warm good evening to all of you. This is Dr. Mansi from Homeopathic 360, and we are back again on the another session of Home Talks 2025 from Homeopathic 360 with collaboration to Parul University. I'm very happy to say that today we have another passionate homeopath from Parul University, Dr. Alpesh Jayswal, currently working as Associate Professor in Organon of Medicine Department at Parul University of Homeopathy and Research, Vadodara, and Ph.D. scholar at Shri Govind Guru University. And he has also doing homeopathic practice since last 4 years. So Dr. Alpesh has many work experience, like he has an experience of assistant professor at Purdue University and has also work experience of QCI NABET College coordinator and as well as member of institutional ethical committee, has a work experience of as subordinator of NSS unit of college, NAAC unit of college and member of IQAC team. He was also a member of NAP accreditation of hospital, plus has experience of arranging different workshops, symposium, and many other seminars as a part of departmental co-curricular activities. We are very happy to say that Dr. Dr. Alpesh was very active in the homeopathic experience and he has done many activities to support homeopathy. So today we have Dr. Alpesh and we are going to learn a lot again in this series. And the topic is balancing hormones naturally, the power of individualized homeopathy for premenstrual syndrome, that is PMS for deletion. So I welcome Dr. Alpesh sir. So please begin your session.
Thank you, ma'am. So it's my pleasure to be here today, and I sincerely thank you, Homoeopathy 360, for inviting me to as a speaker in this webinar series, which collaboration with the Parul University. So in this series, in the last in this series, especially the Homeopathy 360, this collab with the PU. In last few webinar series is collected so many different topics of homeopathy, very basic topic, very important topic of the homeopathy, and it is very helpful to the students and homeopathy fraternity too. So it's my privilege to as a speaker, and I deliver my lecture to the students and homeopathy fraternity. Thank you first, all of you and Dr. Mansi. So let's start today's lecture and today's webinar. Here I'm sharing my screen. Is it visible to all of you?
Yes, sir, clearly visible.
Oh,
You
okay.
can also full screen your PPT.
Yes. Okay, now
Yes,
we will
yes, sir,
start.
fine.
Our today's webinar is balancing hormones naturally. The power of individualized homeopathy for PMS, that is premenstrual syndrome relief. Let's start. First, we understand the balancing hormones naturally. That means the nature which heals us. So in homeopathy, that the same thing is occur. In homeopathy, that always align with the body's innate healing mechanism, working in harmony with its natural rhythm rather than overriding them with external hormones. So in homeopathy, there was there will the holistic approach which treat the patient as a whole with the nature healing. So homeopathy remedies that stimulates the body's self-regulative process. So in homeopathy, there are the remedies which just stimulate your vital force, our vital force. That vital force automatically cure, overcome the different complaints of our body. So this is the basic mechanism of the nature. Okay, you just stimulate the that body's self-regulative process, our immune system in Organon. We also say the vital force. Just stimulate. Now other work is done by the vital force. That the homeopathic remedies power. This individualized approach helps the body adapt naturally without disturbing the body and reducing the symptoms without disrupting its hormonal feedback system. You know, we very well know about the hormonal feedback system. That whole system uh, are that whole systems, all the hormones are set by the nature, and with homeopathy we do not disrupt that hormonal feedback system. We just support the body's immune system and the holistic approach that heal the patient. This holistic method ensure that the treatment works with the body's natural cycle, promoting sustained health and equilibrium. So this is the balancing of hormones with naturally. That is the by homeopathy. Now first we see the overview of the PMS and its impact on women's health. So we know basically the PMS, that is premenstrual syndrome, is the collection of physical, emotional, behavioral symptoms occurring just before the menstruation. It's a very basic and common point. So PMS, that's a collection of three types of symptoms, and it a significant percentage of women impacting daily of life, mood, productivity, and overall well-being. So it's a very common problem, and it affect day-to-day life of the woman. That's common symptoms. So many common symptoms are there. Let's discuss one by one. First, we understand exactly in the terms of definition what is PMS. When we call the PMS is collection of physical, emotional, behavior symptoms that occur in the specifically luteal phase of the menstrual cycle. That is typically 10 days just before the menstruation and resolve with the onset of menstruation. So this is the very basically definitions of the PMS, premenstrual syndrome. And another aspect, okay, this uh, according to practice of medicine, according to subject, when patient defined as a PMS patient, so it's basically last three period cycles, patients having this type of the complaints. So that patient considers a PMS as a diagnosis. Symptoms can range from mild to severe and affect daily activities. Is the very basic point. So there are the different symptoms already we know about it. It's not a new thing, but it's symptoms which affect our day-to-day life, affect in females day-to-day life. Emotional symptoms, that is the in PMS, the emotional symptoms that there are mood swings, irritability, anxiety, depression, sensitivity, crying spells. And physical symptoms on the physical level, that is a there are bloating, wrist tenderness, headache, fatigue, joint, muscle pain. In behavior, symptoms are the food cravings, sleep disturbance, difficult concentrating, withdrawal from social interaction. So this, when we call PMS, it's very simple. The premenstrual syndrome, there's a complaints before the menses. But when we look out the symptoms, that symptoms are on all three aspects: emotional, physical, behavior, and it affect day-to-day life. It's very important. Now let's see the how much prevalence of PMS is highly common in reproductive age women. So with studies indicate that different studies and different data that indicates that 50 to 80% of women experience some PMS symptoms. The severity of symptoms varies, and some women may have very severe phase of the PMS that is called as a premenstrual dysphoric disorder, that is PMDD. So PMDD is nothing but the severe form of the PMS. It is called as a premenstrual dysphoric disorder. Some women feels very severity of the symptoms. Then it is diagnosed as a PMDD. Young women, particularly those in their late teens and early 20s, may be more affected due to hormonal fluctuation and lifestyle factors, that is stress, diet, and sleep pattern. This is the all prevalence. Now let's see the different causes. The different causes for hormonal imbalances is the role of estrogen progesterone fluctuation, the main hormone that impact in imbalancing the hormones and produce the PMS. Impact of stress, diet, and lifestyle is also very important to produce to raising the PMS complaint. How neurotransmitter like serotonin are affected, that is also main cause. Let discuss one by one. Role of estrogen and progesterone is a very basic hormone. As we know, during the menstrual cycle, estrogen and progesterone rise and fall. Imbalance between these hormones is contribute to PMS symptoms. So hormonal imbalance, that estrogen progesterone, okay, sometimes it's rise and fall, that imbalance that produce the PMS symptoms, different type of symptoms. In estrogen dominance, whenever that cause mood swings, irritability, and resist tenderness. Low progesterone can lead to anxiety, depression, and poor sleep. And this fluctuation affect the neurotransmitter and it like serotonin, influencing mood and emotional well-being. So simple, the small quantity of hormones and that imbalancing lead to the different types of symptoms of premenstrual syndrome. Very present era in modern lifestyle, the stress diet and lifestyle is also produce so many complaints in both the sexes, male and female. In female it's in PMS it's also a major role that the impact of stress diet and lifestyle. The stress, a chronic stress that increase cortisol and which disturb the progesterone level and worse the PMS symptoms. In diet, a diet is high in processed food, sugar, caffeine, and alcohol can worsen hormonal imbalances, leading to bloating, fatigue, and mood disturbance. As we know, at the present era, uh, uh, we consume more fast food, oily food, processed food, sugar. Okay, that type of food lead to different types of complaints in our body, and specifically hormonal imbalance is also occur. Lifestyle, sedentary habits, another modern lifestyle issue. The sedentary lifestyle, lack of exercise, and poor sleep quality negatively affect the hormone regulation and PMS severity. These are the causes. And last one is the neurotransmitters like serotonin are affected. That serotonin that is the feel good neurotransmitter is influenced by estrogen level. So connection is there, estrogen and the serotonin. So low serotonin levels can lead to mood swings, irritability, and food cravings. So homeopathy helps this to regulate this neurotransmitter, this hormone by the nature, and address all the aspect of the PMs. Now, major point: homeopathy, a holistic approach. As we understand, as we know about the homeopathy based on the nature principle, that is a similia similibus curantur, and that nature principle and the homeopathy's theory based on the individualization and minimum dose. Okay, this too is the uniqueness of the homeopathy. Another one is the in holistic approach, we address the root cause of the disease, not just only the symptoms, not the outer picture of the disease. We focus on the inner picture of the disease and that cause. And the third one, we restore body by nature. So first, individualization. Okay. So in homeopathy, we believe in individualization. It does not follow one size fits all. एक है सभी के लिए हो जाएगा ऐसा अप्रोच नहीं है. Instead, remedies are selected based on patient unique symptoms, temperament, overall constitution. So through case taking, we go through the each and every aspect of the patient, mental aspect, physical aspect, behavior aspect, that social aspect, the past history, present history, different generalities, all these collectively make the totality of the symptoms, and then we decide, we select a proper similar remedy with the use of repertory, with our knowledge, with Matra Medica, with organ. Okay, these are the trio and which helps to selection of the simillimum, and their simillimum, that perfect a close one simillimum, okay, that for particular individualization or individualized person only. So this is the concept. We believe in a individualization. We focus patient only, patient as a whole. Okay. And the second one, when we give the medicine, we believe in a quality, not a quantity. We believe in a minimum dose. Homeopathic remedies work on the principle of using highly diluted substance to stimulate the body's self-acting mechanism. As I told, that we believe in a quality. Okay? This minimize the side effect and ensure gentle yet effective treatment. So highly potentized medicines are given which act as a dynamic lever to stimulate the vital force, and that vital force uh, uh, react accordingly and to cure the body, and complaints are restored. Most important, we focus on the root cause. Okay, when we call ये होम्योपैथी सभी बीमारियों को जड़ से निकाल के फेंक देते, that means we focus on the cause of disease, not the materialistic cause, not the as Hanuman sir told that they be the materialistic cause, the bacteria, virus, that are the result of the disease, but before that something is that. Okay, that is the cause, that is the root of the cause, root of the disease. We focus that root. Okay, not just symptoms. As we know, conventional treatment for PMS like painkillers, different hormonal tablets, hormonal therapy often focus on symptom suppression. Homeopathy, however, works. Homeopathy, however, works to identify and treat the underlying hormonal imbalances, emotionally triggers, and systemic weakness contributing to PMS. By correcting the root cause, homeopathy provides a long-term relief rather than the temporary symptom control. So, जड़ से बीमारी को ठीक करना, that is the, we focus cause, root cause, and remove them. Okay, as a second aphorism. Okay, that is ideal cure. We achieve the ideal cure. The highest ideal cure is rapid, gentle, permanent restoration to health, removal and annihilation. That means the we remove annihilated that cause from the root. Okay, that is the permanent solution of the symptoms and the permanent solution of that disease, that sickness. Third, we focus hormonal balance to naturally. Okay, restoring the hormonal balance naturally. Homeopathy remedies stimulate the body's regulatory process rather than the artificially alternating hormonal levels. Okay, we give very minimum dose, quality is there, but quantity is less. We give the different potentized remedies, homeopathic remedies, highly potentized, highly diluted medicines like in PMS, pulsatilla, sepia, lachesis, which help to rebalance estrogen and progesterone, improve both physical and emotional symptoms. So it's a natural process. We give dynamic medicine. It help to rebalance, to cure that imbalancing of the hormone through the vital force. And since homeopathy works with the body's natural rhythm, it strengthens overall health without disrupting the endocrine system. Endocrine system, there are so many hormones are there. In the homeopathy, there will be a great scope for this type of disease, hormonal imbalances, endocrinal disease also. Now, just we discuss a few remedies here regarding the PMS, premenstrual syndrome. Okay, in homeopathy, large variety of so many medicines are there for treating the PMS. We just focus on the individualization, so no any fixed medicine for that particular complaint, but as therapeutic knowledge for the student, for us, we at least know, we have information regarding the few important remedies of PMS. There are the sepia, pulsatilla, lachesis, calcarea carb, latrobureticum, ignatia, nux macphos, brownia, conium maculatum. Okay, so many remedies are also there, but just today we discuss the few remedies also. So first one is the sepia. It's a very common basic remedy. It's suited for the woman with marked irritability, indifference to loved ones, and a dragging sensation in the pelvis. Symptoms are often relieved by exercise. Some symptoms are just discussed here, but uh, it's not the final symptoms of that particular medicine. It's just the guideline, just for discussion only. But when we see the CPR patient, when we make the totality, then that totality decides what the medicine is fit for that particular case. Second one is a pulsatilla, which is indicated for the changeable moods, tearfulness, and mild depression. Patient craves consolations and open air. Lachesis, suited for the intense irritability, talkativeness, and intolerance to tight clothing. It's very important for lachesis and talkability and intolerance to tight clothing. Symptoms worse before menses and improve once steady start. Another are the calcarea carb, so women who experience anxiety, excessive fatigue, and breast tenderness before periods. They often have a tendency toward weight gain and chilliness. Natrum is a very basic and very common useful remedy in nowadays present scenario, helpful for women with suppressed emotion. Yes, suppression is more in that present era, that the modern culture. Headache and water retention before menses. They often crave salty food and prefer solitude. So it's very common medicine for present scenario, present lifestyle. Okay, there is suppression, there is a um, suppressed emotions are there, and so many mental disturbance are there. Okay, Ignatia, another great remedy for PMS with emotional hypersensitivity, mood swing, and sign. Helpful for those who suppress grief and disappointment. Another one is the best medicine for suppression, grief, and that disappointment. Nux vomica, it's suited for the woman with marked irritability is that, constipation is that, oversensitivity to stimulus is that. So for Nux vomica is best suited for that types of complaint, that types of woman. Symptoms may be aggravated by stimulus like coffee and alcohol. Okay, another great remedy, magnesia phos, mag phos. It's very indicated for especially spasmodic dysmenorrhea, cramping pain relieved by warmth and pressure. It, that medicine, Menopause, is also used as a biochemic very frequently in day-to-day acute cases in abdominal pain, menses, cramps, such type of complaint. So it's very basic remedy. I always advise to student, please go through the very basic homeopathic acute remedies to try to understand and use as per direction to sir and the physician, use in your family too and surrounding you, that will boost your confidence. So one of the very basic remedy from my side, the macphos is very useful in cramps and spasmodic like pain, and you relieve so many you relieve get relief in so many complaints. Brownia, another very great remedy, useful when there is a breast tenderness, irritability is there, with preference for being left alone, avoiding movement. Conium Mac, last one, is recommended for the painful and swollen breast before menstruation, along with a sense of weakness. This is some guiding symptoms. Some keynote symptoms are only that. But as we know, homeopathy based on individualization and final judgment, just only done by the totality of symptoms, not the keynote symptom. Just make the totality, then you just decide whatever medicine is there comes for as a simillimum that given. Here I am sharing a, small screening, okay, which done by me in my college. Okay, a small scale screening for PMS was conducted among female students. College going girls uh, are there at our college to assess the prevalence and severity of PMS. So this, the screening aim to identify students experiencing significant PMS related discomfort, evaluate the potential cases for further study. In this study, we just circulate one Google form and one questionnaire to among the girls, and just they tick or they fill that form, And after getting that data, we analyze that data, and I will show you. Participants were assessed using a structured questionnaire. That questionnaire is that covering common PMS symptom, including this such type of symptoms. This screening serves as the initial step towards understanding the impact of PMS in young women and exploring individualized homeopathic intervention. Okay, we can further start the treatment also, and we understand how much it affect the in PMS. The finding will contribute the future research on effective homeopathic management of PMS, focusing on holistic and patient-specific treatment approach. Here is a data of that small screening of the 100 girls. Okay, in that screening, total 100 girls are there. Age is 18 to 25 years. Out of 100, 42 girls, 42%. Okay, the girls are said that told that the premenstrual symptoms interfere with her their daily activities. So you just see the data. Okay, out of 100 random 100 girls, so 42%, around 40%. Okay, round figure. The girls are told that the that PMS the symptoms are affect their daily activities. Okay, 46 girls are rate the scale of the 5 to 10. Okay, severity of the PMS symptom 5 to 10. Okay, 1 is mild and 10 is severe. So you just see the how PMS premenstrual symptom syndrome that affect the college going girls in every day to day life. 85 girls girls told that more than two complaints of PMS symptoms are there. Okay, so 85 girls have more than two complaints. 30, 30 girls, 30 patients with irregular menstrual cycle. So out of 100, 70 are regular menstrual cycle. 30 girls having irregular menstrual cycle. So 30% girls having irregular menstrual cycle. Irregular menstrual cycle, it's lead to so many complaints, so many problems in the girls. And 60 out of 100, if we will start, we want to start the study. So out of 100, 60 girls ready to participate to study for homeopathic treatment. So it is a opportunity that this is a very small uh, problem, premenstrual syndrome. When we said that the PMS, it's a simple problem, but it's a major issue among the specifically. I talk about the college girls, school girls. Okay, very basic, very important topic. So we treat with homeopathy, and we give a better result, and cure we resolve all the problems of all the symptoms of the PMS by homeopathy. So it is a very good scope for us. This is a questionnaire. Okay, this is a questionnaire. So many questions are there. You can give a xerox to print out to the students and just tick out and then assess this case is mild, moderate, or severe. In this questionnaire, there is 200 total marks is there. If number score is 41 to 80, then is the mild symptoms, and 81 to 120, that is the moderate symptoms, and 121 to 160, that is severe, and above 161, that is up to 200, that is very severe cases. The four types of cases we can uh, assess through the score. Okay, just tick out the complaints. Okay, whatever the girls having, and then we just assess this is mild case or moderate or severe case. And this questionnaire is online available. It's so many it is personally used by the so many research in homeopathy. Some glimpses of the some research work. Okay, there's a famous very reputed articles which published in the PubMed Web of Science. That articles I will show you, but just title only, because you just go through the PubMed Web of Science and see the different articles regarding homeopathic treatment, and the PMS is also there. Here one article is placebo controlled double blind randomized trial with individualized homeopathic treatment using a symptom cluster approach in women with PMS. Another is the effect of homeopathic treatment women with premenstrual syndrome. It's a pilot study, semi-individualized homeopathic add-on versus usual care only for PMS, a randomized control feasibility study. Okay, so many studies are there. Okay, you just go through the web, PubMed, Web of Science, and study the different articles, different research articles, and to understand how homeopathy helps. So we can also do at our level, our institution, our clinic. Lifestyle dietary recommendation with homeopathic treatment. Every homeopath must advise to patient regarding this such type of suggestion regarding diet, regarding exercise, regarding meditations, because with the help of medicines, it uh, such type of advices, such type of lifestyle changes or dietary advice, it will also help to the medicine or to patient to recover very fast. So as a doctor, it's our duty. First, we have knowledge regarding diet, meditation, yoga, exercise, and different lifestyle changes. That method, okay. At least first we know about that. We have knowledge. Then we also give that knowledge to that patient. Okay, you just follow this like one, two, three. Okay, with the medicine. Okay, so that will help to us to cure the patient, to recover the patient. Okay, importance of balanced diet. It's very important to the PMS patient. Whole food, eating a diet rich in fresh fruits, vegetables, lean proteins, whole grains helps regulate hormones naturally. Sugar level, that reduce intake of sugar, healthy fat, omega-3 fatty foods, okay, flax seeds, walnut, as we know, very basic diet is there. Okay, if you have a PMS, this such type of complaints, then you first follow the basic suggestion, balanced diet and all, and then you take the homeopathy medicines for the treatment. Another main point regarding exercise and stress management, yoga and meditation, very basic. This practice help lower cortisol level, which can otherwise disrupt progesterone balance and worse PMS symptoms. Regular physical activity, exercise like walking, swimming, strengthening training help raise endorphins and reducing irritability, anxiety, and fatigue. Last, sleep and hydration. Okay, water and sleep. It's very basic and very important for the restoration of the health. Okay. The poor sleep affects the hypothalamus pituitary adrenal, that HPA axis, which controls hormonal balance. At least 7 to 9 hours quality sleep is essential. It's not a PMS, but all the disease for a being healthy. Hydration, drinking enough water prevents bloating, supports detoxification, and keeps hormone regulating organs function optimally. So with the treatment, it's our duty to advise such type of advice given to patient. सभी पेशेंट को नहीं पता होता, बट पेशेंट को समझाना पड़ता है कि विद द ट्रीटमेंट you can follow regular good diet, balanced diet, adequate sleep. If patient not take the proper sleep, then you advise you just take the proper sleep, reduce the stress. Okay, you do yoga, you do meditation, so it will also help the patient. And benefits, okay, benefits of the homeopathy, benefits of the homeopathy of the in PMS. So very basic, the benefits. We know the homeopathy is safe and non-toxic. There is no any toxic substance are in the medicines. No side effect or hormonal suppression. Okay, we do not support the suppression of the disease. We support the holistic way to recover the patient naturally. Personalized treatment, as we know, we focus on the individualization of the patient. So we give the personalized treatment as a patient as a whole. We give the treatment which gives the long-term relief and improves overall well-being, not just PMS symptoms. We give the relief to overall, not the particular one, two, three symptoms. So these are the main features of the homeopathy, the benefits of the homeopathy. Homeopathy is a safe and non-toxic because we use highly diluted natural substance, is making it safe for all the individuals, including young women. It does not introduce synthetic hormones or chemicals, which we already know. At present, there are so many hormone conventional treatment, hormonal tablets and hormonal therapies are used chemicals, okay, for treating such type of problem. But in homeopathy, there is no any such things are there. Second is the no side effects or hormonal suppression, unlike conventional treatment, as we know, okay, painkillers and or hormonal therapy. Homeopathy does not interfere with the body's natural hormone rhythm. It works gently to correct imbalances without dependency or withdrawal effects. Third one is the personalized treatment for a long time relief. We treats each woman as an individual and addressing her unique PMS symptom, mental symptom, and constitution. We focus as a individual and we address each and every complaint of that uniqueness of her. Okay, then we make the totality and we give the medicine. This ensure last improve overall well-being, not just symptoms. Okay, we focus as a whole. Okay, homeopathy remedies strengthen the immune system, emotional stability, hormonal health, leading to better energy level, improve digestion, and enhance mental clarity, promotes better quality of life. Talk, when we say quality of life, it is very important present scenario. Uh, public, the patients also believe he he or she want quality of health. Okay, first इसकी क्वालिटी अच्छी करो, हेल्थ अच्छी करो, बेटर करो, तो अच्छे से वो लाइफ जी पाएगा, क्वालिटी ऑफ लाइफ. तो क्वालिटी ऑफ लाइफ, ओके, तो होम्योपैथी प्रमोट्स बेटर क्वालिटी ऑफ लाइफ. ओके, जैसे सारे प्रॉब्लम्स उसको जो हो रहे हैं डेली लाइफ में, जो डिस्टर्बेंस हो रहे हैं, अगर वो इजी वे में, बाय नेचुरल वे में होम्योपैथी से ट्रीट हो रहे हैं, पेशेंट बहुत खुश होगा. ओके, उसकी क्वालिटी ऑफ लाइफ बहुत इंक्रीज होगी. By addressing the root cause of the PMS rather than just symptom management. We do not deal with the symptom management. We deal with the patient, okay, as a whole. This is the main key points of the homeopathy. When you understand this very basic principle, we just focus on the patient. Okay, we just focus on that particular XYZ individual. Okay, then match with your matra medica with the use of your knowledge. Okay, we use the use of the principles and that similarity, okay, of the picture of the individual and picture of the medicine, you give that medicine, but for the particular complaints, okay, whatever the complaint, whatever the disease. So PMS we have better scope. The last one, okay, is the last slide. So in whole discussion, okay, in whole discussion we understand premenstrual syndrome, PMS, very basic. First, we heard that topic. It's very basic, simple, but we when we focus, it's affect day-to-day life of that lady, that girls, okay, and that affect whole work of the day. Okay, so that homeopathy is a blossom. Okay, homeopathy is a very magic for such type of patient. Homeopathy have a very wide range of medicine and scope for such type of complaints. So it's our duty. First, homeopathy, there's the conclusion of whole lecture. The first conclusion is the homeopathy as an effective and natural choice of PMS relief. So with us, the homeopathy knowledge is there. So we use that knowledge because it is only the natural choice for that such type of complaint, PMS relief. Second, the need more awareness and more clinical research. Okay, it's also our duty to do awareness, to do giving the lectures to girls. Okay, if you have such type of complex, then you just contact with such do the treatment. Okay, homeopathy treatment, do this thing. Okay, that type of awareness. Okay, some girls are very shy, do not share such type of problems openly to teacher, to a doctor. So need for awareness, it's very common, and we have the medicines too. Okay, in homeopathy, and more clinical research. In clinical research, we do a different type of study like a randomized double blind. Okay, animal studies are done by the homeopath. So increase the public and scientific validation through clinical studies and can establish homeopathy as a reliable option. The third one is the It's also our duty encouraging the woman to seek holistic health solution. Okay, we encourage our surrounding, in your family, in your college. Okay, you just encourage the woman to please take uh, holistic health solutions like homeopathy or other solutions. Women should be empowered to explore natural and holistic approach rather than just solely relying on conventional medicine. So conventional medicine not a option, last option, first option. First you try the homeopathy medicines, take medicines, you just relieve your complaints. Okay, so these three duties, okay, for giving homeopathic treatment, giving awareness, giving start research and encourage to patients, to women. Okay, so that this is the duty of us. Okay, our homeopathic fraternity, our doctors, our students. Okay, different college students. Okay, so this is the main points of the whole lecture. Okay, so thank you very much all of you for listening me. uh, you can contact me on mail id also and number. Okay, if you have any query, any suggestions regarding my lecture and giving feedback. Okay, thank you so much for listening me. Thank you.
Thank you so much, sir, for this wonderful session. I would like to ask anyone from the audience if they have any doubts and questions. So I think, sir, it's time to wrap up. And the session was very nice and informative. We have learned a lot from PMS, how to diagnose and how to do a homeopathic approach while case taking, while prescription, which is very important to understand while handling such cases. So thank you so much, sir. This
Thank you,
session
ma'am.
will be this session will be uploaded on the YouTube Homeopathic 360. If any attendee want to attend this session again and have any queries, they can ask in the comment section. And they can also put their reviews and suggestions also.
Thank you, ma'am.
Thank you so much, sir. And I would like to inform that anybody can follow us on the Instagram also. We upload all the information regarding homeopathy and the session on our Instagram page.